You're welcome to my channel. Thanks for visiting. Thanks for sharing all my presentations and listening to this very one. But if you haven't subscribed, please kindly remember to do that. If you have subscribed and you are visiting again, I so much appreciate that. Thank you. Today is all about how to get out of the trouble of carbon monoxide poisoning. I tag this "Which way out?" Out of what? That is out of carbon monoxide poisoning. So, if someone has inhaled carbon monoxide inadvertently, or it could be intentionally done, but luckily before he or she will cross to the other side, someone detected that and the person has been brought for medical attention, then how do we treat? So it's all about treatment of carbon monoxide poisoning. Treatment of carbon monoxide poisoning. Before going deeper, as per the treatment, here is the link of the first presentation I published on carbon monoxide poisoning. When you click on this link, you're going to get the full definition. You're going to get the different names that carbon monoxide could be called, depending on the literature you are reviewing. Then, what are the signs and symptoms of carbon monoxide poisoning? How can we make the diagnosis accurately with high index of suspicion and cited investigations to be done? All here. Also, preventive measures, possible complication, and I've also included this very treatment here. When you click on this link, all those points are right here. Once with the high index of suspicion, we are thinking this is carbon monoxide poisoning, then we'll call the poison center. The main goal of everything we're going to talk about today is to give more oxygen to displace carbon monoxide from the hemoglobin. If you have listened to the first presentation, remember I gave you a link just a while ago. There I've stated categorically that carbon monoxide and oxygen are competing for binding sites on hemoglobin. And unfortunately for oxygen, carbon monoxide will have upper hand because carbon monoxide will have higher affinity. So as high as 200 times stronger to bind to hemoglobin than oxygen. Many places we use high flow 100% oxygen therapy through a non-rebreather mask. And of course, the result from the toxicology lab will be revealed as we continue to treat, as we continue to administer our oxygen. Now, since the presentation will be acute, then we go through ABC of acute cases, an emergency, right? Airway must be patent. So we check the orifices for patency. Then, is there any foreign body or secretion with function as it is appropriate? Then we move to breathing, that is respiratory system. Is this person in obvious respiratory distress? Is there flaring of velar nasal or the use of accessory muscles of respiration? What is the O2 sat? What is the respiratory rate? Is there cyanosis anywhere, the central or peripheral cyanosis? Is the trachea deviated in any form? How about chest deformity? Then we'll percuss for donors, and then we'll auscultate for entry. So that must be established. Then we move to C, which is all about circulatory system. Here we'll find out what the BP is, the heart rate, and of course we auscultate for heart sounds. How about fluid in and out? Any sign of dehydration here, skin turgor? How about capillary refill? Then we must set 2 IV lines right now. Immediately, I'll move to rule out pregnancy in any woman or childbearing age. Somebody is telling me pause there. How do you mean? What's your business with ruling out pregnancy? Don't worry. Very soon you understand that the way we are going to treat everybody, particularly determining who is going to have hyperbaric oxygen, will vary depending on whether there's pregnancy or not. If inhalational, injury, if smoke inhalation has occurred in an enclosure, it is possible that we might be dealing with cyanide at the same time. Carbon monoxide and cyanide will coexist, okay? And they have synergistic effect, meaning the outcome of the effect of the two of them is greater than what each of them could have produced. Therefore, we will look for hydroxocobalamin or hydroxycobalamin, depending on where you are. One in England, UK or Europe, the other one in America. It's the same medication, right? So we'll go for hydroxocobalamin or hydroxycobalamin to reverse the effect of cyanide, and we'll give that intravenously in D5 water. Now, we will intubate if necessary, then give 100% oxygen, that is normal baric oxygen. High flow oxygen to all patients, please, irrespective of the pulse oximetry parameters, okay? But hyperbaric oxygen is another thing we can consider. Before going fully into hyperbaric oxygen in carbon monoxide poisoning, let me take you to a full presentation on hyperbaric oxygen already published by me. You can check my channel right here. When you click on this very link, this will take you to full pieces of info on hyperbaric oxygen. Okay, let's quickly review together. Now here on the next slide, when we will need hyperbaric oxygen. Because we're not going to need hyperbaric oxygen all the time. But we need oxygen, normal baric oxygen, for everyone that will present with carbon monoxide poisoning. If it is a mild condition, if carbon monoxide intoxication is mild, then, or even moderate, we don't need hyperbaric oxygen. But if it is greater than 25%, or some will put it as greater than 30%, some literature will put it 25 to 30, but I would rather choose the lower end of it. I just want this man or woman to be out. Then you use hyperbaric oxygen. If the concentration of carbon monoxide is greater than 20% in a pregnant woman, the other time when I said I will rule out pregnancy and someone is mad, what's the business with pregnancy? Okay, you can now see. By the time a pregnant woman will need hyperbaric oxygen, the other woman that is not pregnant will need non-hyperbaric oxygen. Can you see that? If there is loss of consciousness, we'll go for hyperbaric oxygen. In severe acidosis with pH less than 7.1, we go for hyperbaric oxygen. Also, hyperbaric oxygen will be good in carbon monoxide poisoning if it is associated with chest pain. And if you have listened to my full presentation on carbon monoxide poisoning or a separate presentation on signs and symptoms, I have stated in both cases that the brain and the heart will suffer more than the rest organs in the body. Not that the rest organs in the body are free or immune, but they will pay more price. Now, if it is associated with chest pain, we'll go for hyperbaric oxygen. If there is altered mental status, hyperbaric. In neuropsychiatric development, if you have listened to my presentation on signs and symptoms, there's an entity known as delayed neurological sequelae. If that is certain, then hyperbaric oxygen will be required. In other patients, don't make the mistake of treating them less. Let's give them the best. Obvious heart-related issues when EKG has been, like if you have listened to my presentation on diagnosis, now I've stated there that you may have to run your EKG because the heart might be affected. In fact, you can enhance the cardiac enzymes, troponins and CKMB, where that the heart may be affected. You might be running into myocardial infarction, known as heart attack. And lastly, And quickly, for that matter, we'll go back to all the diagnostic parameters. Everything we have taken the sample to get, we'll review them. Although we are not treating the laboratory information, we are treating the human being, right? And that will force us to continue oxygen, regardless of what the parameters will be, until carboxyhemoglobin level is less than 10%. And at the same time, the patient is asymptomatic. Let me explain this. The value of carboxyhemoglobin is not the determinant of whether or not we are going to discharge or the level of toxicity. We will make that determination based mostly on the signs and symptoms. So until the patient is asymptomatic, we cannot stop the oxygen. So we will look for two things. The carboxyhemoglobin is less than 10%. Okay, we'll be thinking, okay, we can stop the oxygen right now. But how about signs and symptoms in this patient? If signs and symptoms are still present, we will not stop it. But if signs and symptoms are gone and carboxyhemoglobin level is less than 10%, okay, we can stop. We can then discharge home if there is no symptoms at all and carboxyhemoglobin is less than 10%, but not in everyone, okay? Carboxyhemoglobin may be greater than 10% and will still discharge home. In who? In smokers. Why that? They can cope with carboxyhemoglobin greater than 10 up to 13%. But once it is 14 and 15, even in smokers, we will not discharge home, we will not stop the oxygen. I think this is clear. We are expected to discharge the patient home if they are no longer symptomatic and carboxyhemoglobin is less than 10%. But if they are smokers, even when carboxyhemoglobin is 10, 11, 12, or 13%, and they are no longer symptomatic, we can discharge home. With that, I've come to the end of this very short presentation on how to treat anyone with carbon monoxide poisoning. Remember, it's likely going to coexist with cyanide, and you've seen briefly how we can quickly reverse the cyanide toxicity. Thanks for listening. Share it with everyone. I appreciate it.